Healthcare, minimizing your risk. Exercises and strategies to prevent falling by Assistance Now and Dr. Christine Baranic. Everyone seems worried about falls. Why are falls so important? A third of adults over 65 years of age fall each year. A quarter of those falls result in lacerations, hip fractures, or head traumas, such as subdural hematomas. Over half of unintentional deaths from injury are due to falls in the 65 plus population. 95% of hip fractures are often from a fall. 20% of people with hip fractures die of complications within a year. I am nervous about falling. Do falls just happen as we get older? Most falls are preventable. While no one can predict who will or will not fall, knowing your risk factors can help identify areas of concern. The higher the number of risk factors you have, the greater your risk of falling. If you know your risk factors, then you can minimize them. Risk factors checklist. Physical risks. History of falls this year. Muscle weakness. Unable to stand from a chair 5 times in 15 seconds without using your hands or weak grip strength. Feeling nervous about falling? Difficulty walking, uneven or off balance walking across the room. Dizziness when standing up, blood pressure drops more than 20 mmHg, or when turning your head. Slowness, reflexes, loss of balance when slightly nudged. Poor vision, cataracts, glaucoma, macular degeneration, blurred vision, or difficulty tracking objects. Poor sensation, partial or complete loss of feeling in your feet. Confusion, not oriented to self, time, and place, or difficulty following simple. Multiple medications, taking 4 or more medications. Taking medications with side effects of weakness or dizziness, or having interactions leading to dizziness, vertigo, particularly hypnotics or benzodiazepines. Poor footwear, loose slippers, unstable base of shoe, poor fitting shoes, or old worn shoes. Any of the following medical conditions, Parkinson's disease, osteoporosis, dementia, arterial fibrillation, seizure disorders, arthritis or joint pain, vertigo, stroke, anemia, loss of limbs, UTI, diabetes, and or incontinence. Home risks. Clutter on the floor, loose rugs, no railings at steps or stairs, no grab bars in showers or near toilets, high threshold bathtub, low toilet seats, poor lighting, particularly during nighttime toileting, poor arrangement of furniture, cluttered, hard to reach objects such as dishes or self-care items, inadequate supervision, behavioral risks, impulsive movements, poor planning, not fully thinking about physical limitations before moving. Carrying items that are too heavy or awkward. Carrying items when a two-handed walker is needed. Using the wrong assistance device, for example, using a cane when a walker is more appropriate. What are some easy things I can do right now to lower my risk? Visit your medical doctor regularly to know if there have been any changes in your medical condition, particularly those affecting your strength, sensation, vision, and memory. See a physical therapist at least once a year to evaluate or identify your fall risk factors. Postural issues or deficits with strength, range of motion, balance, etc., which may limit mobility, to make sure you are still using the right assistive device to individualize your exercise program so you can get the most out of your exercise program. Achieve your highest physical potential safely. Check for home fall risks. See the checklist above. See which risk factors you can change to reduce your number of risk factors and see which ones you cannot. Keep in mind the risk of inactivity is often greater than the risk of activity. There is a 10 to 20% reduction in strength for every week of bed rest. Be sure you have enough. Get sick, you do not become too weak. What are some general exercises that I can start doing now? First, be sure to check with your medical doctor and or physical therapist before beginning any exercises program to be sure you are doing the right exercises for you. Meet with a physical therapist who can develop an individualized program based on your specific conditions, abilities, and goals. Begin a structured exercise program for at least 20 minutes most days. For example, do your strengthening exercises 3 times per week, and if possible, walk for 15 to 30 minutes 3 times per week. It is okay to have a rest day, but do not have more than 2 days off in a row. If any exercises cause you to have pain, dizziness, chest pain, or heaviness, severe shortness of breath, or other unusual symptoms, stop immediately. Feel free to modify any exercise, reduce the range of motion, number of repetitions, or the intensity of the exercise as needed. Set a goal and keep track of your exercises. Goals will help motivate you to do your daily exercises. This was prepared by Assistance Now. They can be contacted at 888-877-7562. Again, that number is 888-877-7562 or www.assistancenow.com.